Hello, I'm Dr. David Hill, and this is a topic that I've been wanting to talk about for quite a long time, because it's hard to turn on the TV or listen to the radio without hearing about teeth in a day, get your beautiful smile in a day, with a lot of nice testimonials. It's also called All on 4 is one of the things you hear about, and they are heavily marketed and popular. And you read about it in magazines, you'll hear it on the radio, you'll see it on TV, and a lot of people have a lot of questions about it. And one of them is, it almost sounds too good to be true. Is it too good to be true? And we're going to discuss some of that and let you decide for yourself whether it's too good to be true or whether it may be right for you. The first thing about the technique, basically there are 4 implants put into either the upper or lower arch. And the teeth are basically, they're screwed to it, they're attached to the 4 implants. Usually the teeth, they're not porcelain. You'll have a hybrid appliance. There'll be a metal base connecting all the implants, like a metal bar, and the teeth will be acrylic or plastic. And this can be done on either the upper arch or the lower or both arches. And obviously, so there's some advantages to this technique. One is the teeth in a day. 2 is usually you don't need bone grafting. You're able to work with the bone that you have. The third area is the implants are somewhat angled to avoid structures such as nerves or sinuses. So usually you're just 4 implants, and that may mean a lower cost also. But now let's kind of look at the other side of it and see some of the problems that you may have with these. Number 1, the teeth that are put in, the teeth in a day that go in are temporary teeth. You would not want your permanent teeth to go in right away, because obviously when there's surgery done, there's going to be healing, the tissues are going to change. So basically the teeth that go in first are not going to fit well. The second factor is often bone must be removed, and we work so hard to preserve bone and save the bone that you have over the years. People that have worn dentures for years have lost a lot of bone. The pressure causes bone to go away, and that happens over time. We really work to save bone, and that's a big disadvantage with this technique, is usually you have to take bone away. The next factor is that on the implants, and remember we're talking about 4 on an arch, the implants are, some of them are angled. Typically the ones on the side are angled, and if you can get a look at that, this kind of gives an idea of the angulation, and it's typically the ones on the ends. And then under these teeth that screw down, there is a metal bar, and that locks it all together. And the reason is because teeth are made from pressure from the top. They take pressure really good like this. They do not do good when they're leaning and pressure is going like that. They do not respond to pressure that well. You can get bone loss and loss of teeth on that, and the same thing can happen on implants. You can have bone loss and loss of implants that way. So typically when you have your 4 implants and you have the 2 that lean, if you lose one of those, you have lost the teeth. The whole case has to be redone. You have to hopefully be able to replace that implant and then make everything over. So, and you lose one, and All on 4 becomes an All on 3. So that is really an issue. You know, in a natural set of teeth, you'll have 16 upper and 16 lower teeth. And most of us have had our wisdom teeth removed, so we'll have 14 teeth in each arch. You're talking about 4 implants supporting 14 teeth. And you know, just from a strength standpoint, if I have my preference, I want at least 5 implants on the lower if I'm putting in fixed teeth or teeth that will cement or screw in. And I want at least 6 on the upper where the bone is not as good. So with All on 4, you're kind of compromising this area and you have a lot of stress. Another factor that you look at, when people clench or grind, they put a lot of stress on their teeth. You know, they break natural teeth from doing this. So the odds of breaking either the porcelain or the plastic on an implant, or actually causing some having bone loss or loss of an implant, are going to be much higher on just 4 than they would be if you have a full set of teeth. So we want to get as many implants as we can. And if I have a preference, we're going to look here. I would like to have the implants upright, where you're biting this way and be supported like that. I'd much rather have 5 or 6 that way than to have the 4. Okay, so in our office, you can often get a case done with 5 or 6 implants for no more than you'd pay at 4 at many offices. So it's much more preferable to try to have 5 or 6 if you can. And really, when you look at this, the teeth in a day, the all on 4, there are certain cases that this would be good for. It would be okay for an elderly patient, say you're 85 years old. That may be very acceptable. It's different when you have someone that's, say, 50 years old, because you really want a long-term appliance that you're going to be able to work with and not have to totally remake or do something later. So you want something with more longevity, more functionality, and you see why it would not be good for a 50-year-old. It's really be more of a temporary fix for them. The other factor is that if somebody just does not have enough bone but for those 4, and that's the only way you can do it, then we do it that way. But there again, it would not be my choice to do it that way. There are better options that are more stable. Like I said, the more implants, the better. The straighter the implant, the better that they hold up, and the less you'd be likely to stress contributing to bone loss or loss of implants. So for most people, the best option would be have as many implants as you can. If you get 1 or 2 extra in each arch, that's going to be much better. It may take a few more visits, but let's take the visits and get more stability. Keep as much bone as you can. You know, we work so hard to keep bone, and I had much rather graft bone and preserve bone, have more to work with down the line. Even as technology gets better and things get better, having that bone is really critical. I'd rather do that than to have to take bone away. And we're basically, I would suggest to just look for a better long-term option, one that's more serviceable, and be sure to ask, you know, what happens if an implant fails, what happens here? Because an all-on-4 turning into an all-on-3, that's a big problem, whereas if you have 5 or 6 and you lose one, you know, you can usually do very well with what you have left. So if you have any more questions about this, I know I've shared a lot of information with you, but sometimes if things look too good to be true, maybe they are, or maybe you need to know what questions to ask. So if you'd like to know more about this, please feel free to contact us or come visit us at Hill Family Dental. Thank you.